Good morning, everyone. Magandang umaga sa lahat, and welcome to the first session of Pregnancy and Beyond 2023. I am Dr. Gia Sison, your host for today's program. Trivia: Pregnancy and Beyond is actually made possible through the efforts of our pediatrics and OB/GYN department. And as a brief background, 10 years na ito. Actually 13, because this program started last 2010 to teach good maternity, pregnancy, and infant care practices to all parents and parents-to-be. Alam naman natin it can get really challenging. But with Pregnancy and Beyond, we will journey with you. So for today's topic, it's very interesting too. We will talk about prenatal, checkups, and giving birth in the new normal. Ano nga ba yung nagbago? And this will be discussed by one of our esteemed doctors here at Makati Medical Center, Dr. Cristina Maledeo-Miravalles. But before we proceed on the topic, we would like to invite you to like our official Facebook and Twitter pages to be updated sa mga latest events, promos, and other health-related tips. So just type in I am Makati Med on the search bar and kami yung may verified checklist. And we would also like to inform you that Makati Medical Center has extended its world-class services to other parts of Metro Manila, such as Makati Med Wellness Center at Ayala North Exchange Tower 1. We have Makati Medical Center Care Access in Araneta City, Cubao, and Makati Medical Center at Discovery Primea in Makati City. Lastly, ito pa ha, you may also avail of our health services right at your doorstep. Yes, you heard it right, at your doorstep with Makati Med at Home services. And with Makati Med at Home, you can have a health checkup, consult, labs, lahat na yata. So just to make it easier for you in the comfort of your home. So for more information about our services, you may call our hotline at 888-888-999 or visit our website at www.makatimed.net.ph. Plus, ito pa, dami. After discussion, we will be giving away raffle prizes. So, we will be giving away Makati Med Care Packs. No? Daming laman. Loaded to. So guys, everyone will register through the link that is actually pinned on the comment section. You're gonna have a chance to win this. So please do click and fill out the form kasi doon kami pipili ng mga winners. So in a bit, ito na yung pinakahihintay nating conversation with Dr. Tina Miravalles. But before that, let's take a short commercial break.
This is the healthy normal. Our children get proper and timely care. Our patients receive safe and finest treatments. We are confident to go to checkups without worries or fear. We experience service that is from the heart. In Makati Medical Center, our patient safety is our top priority. Now is the time to take care of our health more than ever. No fear, no worries, because we are always safe in Makati Med.
And we're back. And as promised, we are now joined by our guest doctor, my batchmate, Dr. Maria Cristina Maledeo-Miravalles. I'll just give you a short background. She's a graduate of medicine from UST. Hindi ko na ibibigay yung batch. And she finished her internship also on UST, finished her OB-GYN residency on Makati Medical Center. And at Makati Medical Center, she's currently an active consultant at the Department of Obstetrics and Gynecology, the outpatient department head from the same department, and the second year residency level coordinator. Plus, she is a member of the Philippine Obstetrics and Gynecology Society, Philippine Society of Climacteric Medicine, and Aesthetic Gynecology Society of the Philippines. So, hello, Tina!
Hi, Gia. Nice to see you.
I know! Welcome to our first ever Pregnancy and Beyond session this 2023. Kumusta ka na?
Okay naman. We're already in the healthy normal.
Kaya nga
Yeah.
So, curious kami kung ano nga ba, and how is it? Kasi I've seen a lot of posts na mga mommies to be,
Yeah.
and then how they have adjusted. So,
Mhm.
yun ang talagang curious ako.
Actually, you can move better now, no? We don't have that much restrictions anymore. Kaya much better.
That's true.
No?
And again, before we start our session today, we would like to remind everyone that we would be opening the question and answer portion right after the presentation of our speaker. Type nyo lang yung comments sa comment section and Tina will be happy to answer them. Basta. And don't forget pala the link doon sa pinned link on the chat box to register to win this Makati Med Care Pack. And please do share this stream, lalo na sa mga kung alam niyo na may kailangan. So we encourage you to share our Facebook Live. And eto suspense na muna tayo ng konti ulit. Before we start, kanina I mentioned about Makati Med at home. Or let me show you how it is. So before we start, let's play that short video on mobile care. Hi, this is Dr. Gia Sison from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access. And we're back na naman, no? Promise na. This is it. So I'm giving the floor now to Dr. Tina Maledeo-Miravalles. Tina, take it away.
Thank you, Gia. So good morning. I'm Dr. Cristina Maledeo-Miravalles again. So I will be talking about what to expect in the hospital during this time of healthy normal. So the truth about prenatal is that pregnancy is not a sickness. The pregnant women go to the clinic, but they're not sick because they have this precious gift, no, which is the baby. So the initial checkup and succeeding ones are aimed to make sure that the mother is healthy and to make sure that the mother is free of any apparent and hidden disease or conditions that might cause harm to her and her baby. Historically, in the 18th century, it was the British, no, who started this prenatal program. And they found out that there's a 50% reduction in mortality for the mom and the baby. And so the other neighboring countries followed. So the benefits of early prenatal for the baby are the following. We can date the pregnancy as to when are you going to have your due date. And then we can assure that the baby is normal by ultrasound. And we usually do it at 11 to 14 weeks. No, most of the time, the patients are so excited that even during the first time that they miss their period, they're gonna go to the clinic and they want to have an ultrasound right away. But for your more value for your money, we have to do the ultrasound at 11 to 14 weeks. Why? At 5 to 6 weeks or 5 to 7 weeks, that's just the first time that we see that that there's a fetal heart rate. While during the 11th to 14th week, you can check other information aside from the heartbeat and aside from the due date. No? So you can see there the nuchal translucency, as you can see in the picture. It's at the nape, baby's nape. No? If it's thickened, it's a marker for Down syndrome. And for those women who are aged 35 and above, we offer OSCAR. What is OSCAR? It's an acronym for One-Stop Clinic for Assessment of Risk, or here in Makati Med, we call it First Trimester Screening. For those with higher risk, we can have the NIPT, or non-invasive prenatal testing. What is this test? The NIPT is actually a blood extraction from the mother, and from that blood, we can see cell-free DNA, which came from the baby. From this test, we can also check the gender of the baby. So imagine it's still 9 weeks or 11 weeks, you can check the gender already of the baby through the NIPT. The drawback here is it's a little bit pricey. No, and also the benefit, one of the benefits of early prenatal is that we can accurately diagnose the twinning. So for the mother, we can screen her for infections through CBC, so other laboratory tests, urinalysis, syphilis, HIV, hepatitis, immunity against German measles. We can screen her for hypertension and preeclampsia. We can give interventional supplementation to avoid neural tube defects. And for those with risk factors, we can intervene by supplementation for prevention of early onset preeclampsia. We can also diagnose and intervene against recurrent pregnancy losses. Now, why is it necessary that we check this mga laboratory tests? So in German measles, for example, if the patient's not immune against German measles and she has this infection, then the baby is mostly affected. So the baby can have congenital heart defects, congenital cataract, and congenital deafness. So those are the things that are why we request for laboratory tests. This is to reveal the health status of the mother that cannot be obtained from history and physical examination. Okay, so what to eat during pregnancy? You should eat a balanced diet with food rich in protein, carbohydrates, and low in fat. In the first 12 weeks of pregnancy, some might have difficulty eating due to nausea and vomiting. In layman's term, we term it as parang lihi. So what we usually advise a patient is to try small, frequent feeding. You can also drink milk if you're not milk tolerant, and you have to increase your fiber-rich food in the diet because fiber-rich food will prevent constipation, especially in the last 3 months of pregnancy. During pregnancy, you have a decrease in gastrointestinal tract motility. Okay, so what kinds of food to eat and what supplements to take? Those food sources that are macronutrients, which we get it from the bulk of the food, that is the protein, the carbohydrates, and the fats, and also the micronutrients. These are the vitamins and minerals, which are very small ingredients that we cannot see. Okay. So aside from that, what supplements should a pregnant take? So for the first 3 months, or even before getting pregnant, 3 months before getting pregnant, the mother should take folic acid. This can decrease the risk of neural tube defects by 80%. So what is this neural tube defect? It's actually the brain and the spinal cord and the covering of the brain and spinal cord. Aside from that, women are being given iron and calcium. However, iron can cause gastritis and can increase the nausea and vomiting of pregnancy. So sometimes we give it at 3 months of pregnancy, after the 3rd month of pregnancy. Iron is taken to prevent anemia that is prevalent among Filipino pregnant women. Calcium, we give it twice a day for the bone development of the baby, because if the mother won't take calcium, she is at risk for osteoporosis in the near future. Okay. We also give calcium because there are some women who are milk intolerant and they cannot tolerate milk. What to avoid during pregnancy? please avoid alcohol and smoking. Alcohol can cause fetal alcohol syndrome, manifested as delayed growth of the baby and uh, delayed brain development, which can be manifested or can still continue after birth. How about smoking? Smoking can cause low birth weight. Now we go to the COVID vaccine. Are you going to avoid the COVID vaccine? The ACOG, which is the American Organization of the OBGYN, and the POGS, the Philippine OBGYN Society, recommend COVID vaccination because pregnant women are a vulnerable population who needs protection. And animal studies have not identified adverse effects on conceptuses or the fetuses. No, there's not enough human data on effects of mRNA vaccines on babies, but because of the potential benefits outweigh the possible harm to the mom and the baby, we still give COVID vaccine. As evident now, we have decreased rates of COVID infection. So again, when are you going to have your ultrasound? To make it sulit, do it at 11 to 14 weeks, done the 6 weeks, no? 6 weeks, you'll just do it if there's a reason like vaginal bleeding or lower abdominal pain, because this might be a ectopic pregnancy or a miscarriage. But to make value for your money, do it at 11 to 14 weeks to get more information. And then routinarily, we do it again on 18 to 24 weeks, wherein you can have your congenital scan and you can see the gender, plus the internal and external anatomy of your baby. We see if there's defects. Okay. So how frequent are the prenatal checkups now for those with no high-risk condition? We usually do it every 4 weeks in the first 28 weeks, and then every 2 weeks after 7 months, which is 28 to 36 weeks. And when the patient is already at 36 weeks, we do it every week. So we're going to compare the pandemic, the height of the pandemic, and the present healthy normal. So before, we used to have a face-to-face, but it's really spaced out. No, we have to have an appointment. We have to utilize telehealth, and we have to monitor or just time the ultrasound examination. Now we're back to what I've told you a while ago. That's every 4 weeks, every 28 weeks, every 2 weeks from 28 to 36 weeks, and every week 36 weeks to delivery. The conduct of prenatal checkups during the pandemic time was before by appointment to prevent crowding. What we do right now, we still encourage by appointment schedule to rather than the walk-in to avoid crowding, and social distancing still encouraged. Before, we had this screening form before going to the hospital. Now we don't need it. Aside from the face mask, before we still need the face shield. Now it's just a face mask. No, we still encourage face mask inside the hospital. Okay, we go to the high-risk pregnancy. What is a high-risk pregnancy? It's a conditions where the outcome for the mother and the baby might not be good. So these are exemplified by diabetes in pregnancy. Most of the time, Filipinos are high risk, no? Because we live in the Asia Pacific and we eat rice, source of sugar. And especially those women who have higher BMI, body mass index, before and during pregnancy are at high risk for diabetes. Second, hypertension, previous cesarean section or myomectomy, previous abortion, previous preterm birth, previous recurrent pregnancy loss, and autoimmune diseases. Why is previous cesarean section a high-risk pregnancy? Because if there's a chance, but very minimal, that if the patient goes into contraction, there's a risk of uterine rupture. Okay. So we go now to the danger signs in pregnancy. So what are these? These are recurrent lower abdominal cramps. This might be a risk for miscarriage or an ectopic pregnancy, vaginal bleeding, miscarriage again, or preterm birth. Severe epigastric pain might lead to preeclampsia and severe headache. So the new normal preparations for labor and delivery for the mother, before we have this COVID RT-PCR, before going to the clinic or before being admitted and staying at home before labor, and the result should be negative within 14 days. But right now, as of February 10, we receive a memo from the Infection Prevention Committee of Makati Med that patients with no signs and symptoms of COVID-19, regardless of the vaccination status, will not be required to undergo RT-PCR prior to admission. However, it depends on your attending physician. Those with signs and symptoms might still be, the RT-PCR might still be needed. And for those companions or husbands who want to enter the delivery room, vaccination card with booster is still required. Now, when would you know that you have to go to the hospital? So if you have regular abdominal cramps, like every 5 to 10 minutes, if you have bloody show, and if you have watery vaginal discharge, you know that it's time to go to the hospital or to the delivery room. Okay, so what is painless labor? This is being given in our institution. We call it epidural anesthesia. It started here back in 1969 during the time of Dr. Paz Porres. And it was given to the patients of Dr. Constantino Manahan, our founder, and later on to the patient of other doctors. Labor pain is blocked, but not the ability to move the legs. It's being given at the back, at the level of the third lumbar vertebra and fourth lumbar vertebra. Okay. So during labor, when the patient is admitted in the delivery, be hooked to the tocodynamometer or fetal heart rate monitor. As you can see there are two belts, no, in the pregnant woman. One is in the side, the lower side, which detects the heart rate of the baby, and the other one, the top portion, the red one, is for the uterine activity or for the uterine contraction. And it can be seen in that tracing. The first half, the upper portion, is the heart rate of the baby. So the normal for that is 120 to 160. As you can see here, this is an actual patient of mine who had this tracing. As you can see, the heartbeat goes down, no? And you can see the lower portion, that's the uterine activity. There's an increase in amplitude of the uterine activity, and it's every 3 minutes. One box is 1 minute. So every time the amplitude of the contraction increases, the baby's heart rate goes down. So there's an immediate need of delivery of the baby. It depends whether it's a cesarean section or vaginal birth. So you would know here that the labor and delivery is a perilous journey that can be made safe only by you if you're going to have prenatal checkup, can be made safe by your expert doctor, and by the hospital like the Makati Medical Center. Before I end, I would like to take you to a virtual tour. This virtual tour is done by our resident, Dr. Mikey Comendador. And so I'll just end up here and you're gonna see the virtual tour of the delivery room. Thank you.
And we're back again. So, Tina, thanks so much. Grabe yung information na binigay mo nowadays.
You're welcome.
Ang galing. So, would you say na talagang it's less restrictive na now, no?
Yes, it is.
Kasi before, para I remember, it was a huge, parang it's a huge issue na hindi mo kasama yung husband mo or partner mo sa labor. So I guess now,
plus the
okay
fact
na,
that you're going to have RT-PCR and
Oh,
it required
isa
is
pa yun.
about 2 weeks and you're gonna repeat it again if you
Yes.
did not deliver in 2 weeks time.
That's true. So talagang that's how the support of family comes in. And of course, yung
Yes.
healthcare support.
It's good that we
moms
have
need.
the social
Yeah.
wherein you can contact your husband even through the phone.
Yes, the video call.
Give a video call.
Yes, that's true. So, before we proceed to the question and answer portion, again, remind ko lang kayo to please click and fill up the pinned registration link on the comment box for a chance to win a Makati Med gift pack. Now, this gift pack contains your essentials. Everything is there. Basta it's nice. So, we're on to our Q&A. We'll read some of your questions na nakita namin sa comment section. First question is from Donna Rakea. Okay, Donna asked, so Tina, what is the best age gap to have a baby again if you are a normal delivery?
Okay. Even if you're a normal delivery or a cesarean section, the normal age gap before you're having a baby gets about 2 years.
2 years.
2 years.
Okay.
Why? Because we need your body to recover.
Right.
During pregnancy, the baby is just like a mini parasite.
Yes.
No, it gets your blood, it gets your calcium from your bones. So you end up being calcium deficient in the bones somehow. So you have to recover from that. Plus the fact that you're going to breastfeed.
Yes.
So breastfeeding also, the baby will gonna get calcium from your milk. Where do you get that calcium? From your bones again.
Yeah.
So you have to recover from those, no?
So 2 years.
2 years.
Pero Tina, is there a difference between normal delivery and cesarean section naman? Yung age gap?
Age gap?
Same?
Same.
Same. 2 years. Okay. So, guys, remember, 2 years. And breastfeeding is best for babies. Another question is from, again, Donna Rakisa. Is there a study now, the effect of our COVID booster can make a mother early delivery than the due? I think she's, yun, kung parang preterm, high risk
I think
ba?
there's no study yet if there's a
No
risk,
study.
no? I think the COVID virus itself
Yes.
can cause somehow preterm delivery. Somehow it's connected to hypertension.
Okay, so better to have yourself vaccinated.
Yes.
Okay, that's
Protect also your baby, no?
good. Right, and you and the mother.
The
also.
mother.
Okay, from Dan Risho, will it affect the baby if my family keeps on smoking even though my wife does not? So secondhand smoke.
Okay, it's a secondhand smoke. So definitely it will affect your wife first.
Mhm.
And then when your wife inhales the smoke,
Yes.
then your baby will gonna get affected also.
Ayan, so
So-
it's very important, no, na i-remind and
What's the effect of the smoking? Low birth weight.
low birth weight. So stop smoking, guys. Tina, I'm curious kasi I watch these prepare with me yung mga hospital bags, no? What are the essentials na dapat dalhin ni mommy sa hospital?
Okay, number 1 are your documents.
Documents.
Okay, what are those documents? Order from your doctor. Even though if you don't have the order sheet, our resident doctors are capable of doing the orders. No? Aside from those are, I think they're still getting the marriage certificate.
Yes.
No?
Yes.
Plus the PhilHealth forms, your SSS. Don't forget those because it's so hard to come back to the hospital and have it filled up again. No? Other than that, you can, the essentials.
Yes.
Toiletries, extra clothes, and also like this one, no? It's the
That's
pack
right.
is actually,
That's right. The pack is complete.
complete. So
Yeah.
those things.
Okay. Yung iba pa nga, they have separate packs per day, which is very nice. Yung parang for Monday, it's labeled well.
Okay.
Now, we have a question from Jenny Villa. When is it decided to have a cesarean section than normal delivery?
Okay, we have indications. Number 1, if there's fetal distress, as you can see in the lecture a while ago, there's a fetal distress, the heartbeat is going down, the baby probably may not be tolerating, there's a decreased oxygen. Number 2, if there's a, the dilatation,
Yes.
it does not dilate. So we need 10 centimeters of dilatation.
Yes.
So it's arrest in dilatation.
Okay.
Or, ito yung pinakamasaklap ha, The dilatation is 10 centimeters already.
Okay.
But the baby's head does not go down.
Oh, yun lang.
That's arrest in descent.
Yes.
Nagpakahirap ka na lahat,
Hindi bumababa.
hindi bumababa. And then
Oo
we'll
nga.
end up, cesarean. So those are the things that are indications for having a cesarean section.
Tina, how about yung suhi ba yung term doon? Yung,
Yeah, at that
yung
one also,
position,
the
yeah.
bridge, no? It's a relative contraindication. For a first-time mom, we usually do a cesarean section because the pelvic walls are not yet tried and tested. Baka
Oh.
maipit yung head doon. But if you're a segundi or more, you can probably try, but naku, nakakatakot.
That's
no?
true. Yeah, that's very common. No?
Yeah,
Thanks,
malpresentation.
Yeah, thanks for that question, Jenny. Now, our viewers are asking tips naman daw on giving birth in the new normal.
So before that, you have to have prenatal checkup. No, do whatever your doctors tell you.
Yes.
You have to have your vaccinations, COVID-19. No,
Yes.
it's essential. Aside from that, if you're not yet up to date with your vaccination, you can have the vaccinations that are required or can be given to the pregnant woman are hepatitis B, flu vaccine, and tetanus. So tetanus is very important, especially the Tdap. Tdap is tetanus, diphtheria, and against pertussis. So this one, you can protect your baby.
Right.
And it's not just the mom, no? You have to give Tdap also to the father and to
Right.
those who are within the household to protect the baby.
Yun, no? So
Okay.
it's, I think pregnancy is a holistic approach.
Yeah.
Where
Whole
you
family.
work, whole family, and whatever support system you can get, that's so important. And talk to your doctor.
Mhm.
Huwag kayo basta magte-take or kasi iba nakikinig sa, sabi
I
nila.
also advise to to write their questions.
Write your questions.
Because most of the time, when they go home already, that's the time they will text the
habol.
second habol ng you have to write down your questions so that when you're already the doctor, captured audience mo sa siya.
Oo nga,
No?
totoo. Yeah, that's a nice tip, no?
Yeah.
Write down your questions so that on your next visit, lahat na. Parang comprehensive
tackled.
na.
Most of the time, they forget what they're going to ask.
That's true, that's true. So, looks like madami ng question. So, meron pa kami question from Judy Mercado. Yung epidural anesthesia po ba ay effective? No pain talaga?
Okay. The epidural is an anesthesia. No, we give it at the lower lumbar vertebra, no, L3 and L4. It's being given outside of the spinal cord, outside of the dura, the covering of the spinal cord. It's really effective. No, we usually give it at an active phase of labor,
Yes.
around 6 centimeters, because if you give it too early, the tendency is
Hindi mag-push.
your labor will be prolonged.
Yes, yes.
Okay.
So, it's effective, no? So, yan yung tinatawag yata, Tina, na
Painless.
painless delivery. So, hindi po, debunk ko lang yung myth na, kasi may iba na it's dangerous daw, nakakakos ng paralysis. May ganun kasing sinasabi nila.
If probably it's being given to deep.
Yes.
It's beyond.
So best to have it done by
An
specialist, an expert. So we have another question. Last question for today's episode is from Judy. Lithotomy position lang po ba ang position sa hospital? I think she's referring doon sa
Giving birth. Okay. If you have epidural anesthesia kasi, it's so hard for you to move na, no?
Yes.
So the only position that you can have is lithotomy. But if you're not on epidural, like in Lamas,
yes,
you can have your position whatever, no? Whatever position you would like. You'll be in the tub. I forgot pala to say that, I think it was shown in the video that there's a water birth here.
Yun. Water birth. What is water birth?
Water birth, the mother is in the tub.
Okay.
It's actually heated.
Okay.
And we can actually, check the heartbeat of the, we have a monitor to check the heartbeat of the baby, even if the mother's on the tub.
Okay.
And the doctor can deliver the baby while inside the tub. No, the mother is inside the tub. We have a long gloves, and the doctor can deliver the baby from it.
Does it have its advantages over?
Well, it's there's no medicine kasi it's Lamas.
So you feel the labor all throughout.
You feel the labor all throughout, and however the water, it's the one that's giving you parang a sort of anesthetic effect.
Okay. Parang it
calms you down.
calms you down.
Mm.
Okay. I've always been wondering about water birth. Anyway, earlier, Genevieve asked, just to follow up to her question, is it okay to go cesarean earlier than the due date?
Okay, if there's an indication,
Okay.
indication like hypertension,
Yes.
okay, if there's a problem with the baby. However, we recommend a repeat cesarean section at 39 weeks.
39
Because
weeks.
to prevent any parang premature delivery.
So, there you go, no? Ang dami nating natutunan kay Tina on how it is now in the new normal. It's less restrictive. Before
Mhm.
kasi talaga, it was sad. For all of us rin naman. I think giving birth is a celebration and being pregnant, di ba?
We only have one lang now, negative pressure room. Before kasi
Yes.
during the we have two. So it's
So
so
yun.
difficult.
Yeah, so only one. So anyway,
In the delivery room. I don't know
in
in
the
the
delivery
in the
room.
OR. There's still negative pressure in the OR.
Okay, so thanks Tina for an enlightening
Welcome.
lecture on how to ano yung
What to
prenatal
expect.
checkups, what to expect in pregnancy in the new normal. Now let's proceed ngayon sa raffle program, no? So the exciting part of the program.
I think it was pre-drawn during the video.
Yes, it was
Mhm.
pre-drawn, and I will be mentioning the names of the 3 winners. By the way, winners can claim their Makati Med gift pack upon their next visit at Makati Medical Center. And if you win, please contact 888888999 local
Ilang 8 na ba
3757.
yan? 1, 2, 3, 5.
Yan yung yan yung code natin. 5 8s, 3 9s local 3757 for a swifter communication. So the winners are number 1, congratulations, Ayesa or Ayesa Villa. Okay, Ayesa Villa. Winner number 2, Stephanie De Mesa. And winner number 3 is Jenica Galoyo. So again, Ayesa Villa, Stephanie De Mesa, Jenica Galoyo. Congratulations,
Congratulations.
guys. Now, if you want to schedule a consultation with Tina, please call again 888888999. And our call center will schedule you at the most convenient time. So that's all for today. Again, thank you, Tina, for sharing your expertise
Thank you,
with us today.
Gia.
And it's always a pleasure to have you at Pregnancy and Beyond in Makati Medical Center. So now, this kind of concludes our program for this month, guys, because we will be back by March 18th. This is going to be a monthly thing with us, conversation. So please follow our official Makati Med social media accounts to get free lectures that can help you on your pregnancy journey. Again, thank you everyone who attended, and thank you for your support. I know it's a Saturday. Have a restful Saturday. And if you have any suggestions, you may email us at iammakatimed@makatimed.net.ph. So see you next month and have a great day.
Enjoy your
Bye-bye.
weekend.